We'll get started in just a minute, folks. We're just waiting on Chad. LG, do you want to just get us started while we're waiting on Chad?
Yeah, I'm happy to do that. I was just going to unmute and ask that question. So Chad will give, his various updates on current state. I'll just give the sweeping, news, which is no surprise to anyone. Things are getting better. Overall, I think you all are seeing fewer patients within your practices with COVID at this point. Things are better from the hospital end of things. So we're going to reverse the order today. We'll start with things sort of pediatric and child and school focused, if that's okay. And then we'll give Chad the opportunity to do his update afterwards. And believe it or not, there is very little to give in terms of updates because there have been no changes in guidance at this point. We all know that in terms of the masking mandate that is still in effect for schools, we're anticipating that will continue from the state through at least hopefully mid-March, or at least the governor is going to reassess towards the end of the first week of March. I think you all are very much aware that many school districts now have been piloting surveys, looking at their constituents, their parents and caregivers' feelings about optional masking. That's created a lot of distress on the part of the healthcare community, I know, but what we are hearing is that there will not be any specific mandates that will come from county departments of health around guidance for schools around masking. And so at some point in time, when the state, when the state mandate is lifted, it will end up being within control of individual school districts and school boards. So I'm watching Elizabeth Marie's face there, but that is a fact. We have heard that in multiple settings now from all of the Finger Lakes counties. So I think that the one thing I hoped that would be available to show you today, but I've been promised that it will be done before the end of the week. In a collaborative effort, the schools reopening, the Finger Lakes Schools Reopening Task Force team pulled together sort of a group of infection prevention experts, public health, primary care, specialty, pediatricians, family physicians, teams to just develop a very simple infographic that really is to give bulleted speaking points and information. And I can tell you essentially what those bullet points are, but it's not going to look as pretty as the infographic. And as soon as that's available, we'll send that out to you with sort of special messaging for you to be able to use with your practices, with your families, to help you as you can articulate this message. The top line of it is kids need to be in school, and keeping schools open and children in school is a top priority. To do so, it's important that families understand that masks work. And it gives some information about that and why it is important. The second bullet is that vaccines work and are safe, or they're safe and they work. I can't remember how they put this, but not only in terms of the efficacy of the vaccination, but particularly when we think about MIS-C. We learned about sort of updates about that last week with Dr. Solon from Golisano Children's Hospital in terms of what we're seeing locally. There is no question that that has a huge protective effect for kids, and we want that message to get out. And then really the other key message in this is that schools are congregate settings. So it's different. It's not the same as going to a restaurant or to a bar or to a store. That there's a very different approach that needs to be followed. Whether this has an impact on any individual school district and what they choose to do, I don't know, but the more that we can have a very clear, coherent, aligned, simple message that doesn't stray all over the place, I think the better that we can be. So that is the main update that I have. Of course, the other thing is just that, as you all know, we're not starting vaccination for 6 months and older yet. But I do think that what we have realized also is that the place where that vaccination will take place will be in primary care settings. There will be only a very rare community-based or centralized location where that 6 months to 4 vaccination opportunity will be available. The county health departments are not planning to vaccinate for that age group in any kind of a centralized larger clinic setting, and that's across our region. So just to explain, many of you have received another updated survey from AHP, just sort of checking in to see how you're doing and what you're doing. And that's not to be a nuisance to you, it's to try to help us then identify who might need some help. Because anyone who has not yet implemented a process for vaccinating, who cares for children, whether that's family medicine or pediatrics, needs to be ready to be able to serve their families. And so we want to be helpful in that space. Jana has the toolkit that will be released very shortly. But we want to be helpful, not just to give you a toolkit, but to check in and see what do you need, what support can we offer in terms of getting your ordering process set up, all those sort of steps that it takes. And we are still advocating for opportunities with the county to have some centralized function, potentially partnering with Golisano Children's Hospital team. The Golisano Children's Hospital pediatric practice does have a children and families clinic that's open to the community. Right now, they're vaccinating 5 and up, including adults, and that's happening 1 night a week. They will plan to ramp up for a few weeks just to be able to support those families who are not able to access vaccination in their own practice. But clearly the messaging that's going to come when the vaccine is released is going to be very clear to contact your pediatrician or family physician, your primary care practice about vaccine. And so we just want to be as supportive and helpful to your teams as possible. If you got this down, that's awesome. And just the one other piece of information to share around that is there's a definite push from the county, or not from the county, excuse me, from the state to counties and hospitals to move away from reallocation of vaccination. So for those of you that are either exclusively receiving vaccine from the county or doing some kind of a hybrid model where you're ordering and receiving some allocation, that is not stopping right now, but there clearly is some movement to encourage more direct ordering from the state. So we just want you to be aware of that. And if you're having difficulties in that space, let us know. We recognize that the biggest barrier, and we're advocating to the state as the counties and the hospitals are, is for the older kids, the allotment of vaccine is just, it's too big in terms of the demand that you might have in your practice at this point for the 12 and up. It's just, it's a big shipment that you have to take. So we're asking for more time on the reallocation model, ideally for another few months, especially when we would need to get things kind of stood up for the younger kids. But if you're already in the process of moving over to ordering your vaccine directly from the state, more power to you. That's a good thing. It's not going to dry up immediately, but we just want people to be aware that moving in that direction will be a good thing. So I don't know if anybody from AHP wants to speak more about the vaccination opportunities, and then I just wanted to turn it over to Elizabeth. And I see that the good Dr. Teeters has joined us, and so then we'll give him the floor after. We reversed the order. We talked about Perfect. Children as the center of everything first, and then you can talk about the rest of the world. So.
Sorry, I got so excited in another meeting, I completely lost track of time.
It's okay.
11:30. I'm like, oh, look at this. And I was like, holy crap, it's not 11:30.
So I don't know if Kim or Renee have any other comments about the vaccine efforts. We're good. Okay. So the partnership around supporting vaccination for kids at the county sites is continuing right now. It's just when the expansion happens to 6 months that things will change. Elizabeth, go for it. What's your
Hello.
good word of the day?
Let's see. Thank you for your time.
Thank you so much. Chad.
Yay, in reverse. So sorry, everybody. Should never leave without my phone, and that's a dangerous thing because it's like my accessory brain and the only time stamp I have. So if that doesn't alarm and tell me I'm supposed to be somewhere, then I'm just left wondering about on my own fruition. That's a bad thing. So we are actually continuing to see positive improvement. So if you look across the Finger Lakes region, almost in every county, we are about 8 to 10-fold less daily incidence rate than what we were at the peak of the Omicron wave, which is excellent. Hospitalization is plateauing a bit. And it's uncertain as to why at this moment. We definitely are seeing that it's either younger folks who are unvaccinated, older folks who are vaccinated and not boosted primarily. So those statistics largely aren't changed, but for possibly the first time, the hospitalization rate does not seem to be tracking as you would expect with the decrease in daily incidence rate. So while the hospitalization rate is lower and the ICU rate is definitely lower, the general hospitalization rate has not fallen as precipitously as the daily case rate has. So we'll continue to follow and kind of see that, but certainly for the first time, probably in weeks, many of the hospitals actually have bed availability, which has not been the case for quite some time. So that's good. I will say from a booster mandate, we are literally waiting by the hour. So Monday would be the official date of the Hochul administration's booster mandate to kick into effect. We have heard that there is very likely, and there is ongoing effort, and I'll say lobbying with the governor's office to push the booster mandate for healthcare entities at least 90 days and perhaps to stay the booster mandate altogether. It sounds like all of those options are being considered and potentially more at this moment. And that there has been some, at least tip of the hat, that no one should be intending to accept resignation of anybody between now and Monday, as there's some anticipation that we will see some leniency from this. I can say that as recently as this morning, Haney's Hospital Association of New York State had said they were having yet another meeting with the governor's office today at lunchtime. So I'm sure there'll be more information forthcoming. This is one of those things where it's minute to minute, depending on who talked to who within the DOH or the governor's office as to which direction things seem to be going. But the anticipation seems to be that it likely could be last minute, and it could even be Monday before we have any definitive answer as to whether the mandate will be delayed in enforcement. But certainly the anticipation is nobody is going to be showing up at hospitals or practices that are located within hospitals with a roster and looking to see who's been boosted and who's not. We also have heard, and even the DOH commissioner has tipped her hat, that there is an expectation that there will be an increase in leniency for what will qualify as a medical exemption. We do not know at this point how broad they are willing to publicize, or whether they're going to leave that completely to healthcare entities to decide. We also do not know if testing will be considered a requirement. And it does seem that if they do allow broader medical exemption, that they will allow those people to continue to serve in patient care roles. Remember, with the original vaccine mandate, if you got a medical or religious exemption, you were not allowed to come into contact with patients or come into contact with those who would be coming into contact with patients. So you effectively could only be exempted if you had a completely remote role that would never come into contact with anybody in the healthcare enterprise per se. So it sounds like that too may be different. So lots of evolution in this, minute to minute, hour to hour. I suspect it probably will not be decided at least until the end of the week, and it could go well into the weekend or even early Monday before we have a definitive final answer. Other factor, we had talked before about the antiviral therapies, Mupiravir and Paxlovid. The Mupiravir, I always say that wrong, and I keep saying I'm going to memorize it once and for all, and I just haven't yet. So that one is more readily available. However, remember that the efficacy is only about a 30% reduction. So it's not as seemingly helpful as Paxlovid, which definitely seems to be the more helpful, only supposed to be in high-risk individuals who develop COVID and are preferably within 5 days of onset of symptoms. Paxlovid, as of yesterday, there were about 350 doses available in the immediate region and pharmacies. There is a website that we can actually put out today that you can actually check and see which pharmacies actually have availability. Know that that website is reasonably well kept up to date, but it is not minute to minute. And some pharmacies may have 1 or 2 dosing regimens available. So it's not like they have 200 at this pharmacy, but it's maintained by the state. It generally seems to be upkept regularly, at least daily, I would say. But I would not venture that what's true at 8 in the morning will necessarily be true at 3 o'clock in the afternoon, given that there's a relatively reasonable paucity of doses across the region. That being said, with the somewhat precipitous decline in new cases in most areas, there's obviously less competition for those doses at the same time. So that's likely to mean that there will continue to be a persistence of dosing. Along with that, I will say, just from personal experience going into pharmacies and Walmart, Target, suddenly there seems to be more COVID antigen tests on shelves. I will say, if you've seen one pharmacy's offering, you've seen one pharmacy's offering. It is the colors of the rainbow as far as every company in America now seems to be making a COVID test. And just being kind of a nerd, and because I'm not a big shopper, sometimes I just like to stop and read what the stated sensitivity and specificity is. I can honestly say the less prominent it is, and in some cases not on the box at all, if you do the digging, you generally find that the sensitivity and specificity may not be that good. So just know that there are a host of these, everything from you have to have a smartphone so that you plug the little interpreter into the bottom of the charging port of the smartphone, to one of them that looked like a chemistry set that you have to have test tubes that you mix up the swab and dip a dipstick in it, and then you have to shake it for a period of time. And they're just a whole cluster of differing modalities of check. Most of them seem to be like the pregnancy test, 1 line, 2 lines, you got it, you don't. So most of them are pretty user friendly, but some of them I can imagine some of our folks would not have the easiest of go at it necessarily. So just know that they are becoming more prevalent. The government, I can attest to personal delivery. Those tests that were delivered free to homes that signed up for them through the .gov system, they are now being delivered. So even those are kind of weird chemistry set versions I can speak to as well. So just know that the paucity of antigen testing is possibly not as bad as it was before, but the complexity of the kits and the variance in sensitivity and specificity does remain relatively high in those kits at this moment. And unfortunately, there are now so many that I can't even tell you that these 5 seem to be the soup du jour. But I think iHealth and Abbott Binax Now continue to be the ones that routinely seem to be the highest sensitivity if they're available they also seem to be the ones that sell out the fastest, just from my own shopping interest. So that's that. Otherwise, I don't think there's a whole lot of other new expectation or coming excitement in the coming days from a general standpoint. We are seeing, as the decentralization of decision-making about local masking requirements and all the like. We're seeing some places, I can say from personal experience, certainly the farther out you go, the less masking you see, but I can say even, my kids in youth sporting events, I was shocked in the dome for lacrosse that I don't think anybody even had a mask, much less wearing it for that matter. So there's definitely a lot more of that happening every day. That's, I think, all I have. The only other point that I was going to bring up is next week we have several conflicts from all of us on the AHP side of other meetings or time away. And since things seem to be at a calmer interval, we were going to skip next week's session and then pick back up in the beginning of March, hoping that everything is calm and cool heading into this last week of February. There's 3 at-home tests mentioned that are more consistent. Yeah, so Binax Now and iHealth seem to be the 2 most reliable that I'm aware of at this point. And Dr. Shipley playing Vanna White once again.
Except I hit send too fast. I only got 1 out there. I was having a difficult time navigating my typing.
So I think that's all I have. Anything else? LJ, Renee, Jana? Nobody?
Just if there's any questions, but the chat was very quiet.
Yeah. It's a good time to be bored with COVID right now. That's a good thing. I will mention this is only for those who spend time in hospitals. It was interesting. FF Thompson had their General Joint Commission hospital survey. And for the first time ever, they did ask to see the COVID vaccination database for all employees. And while they did not ask for proof of what the exemptions were for, they did go through it and do some tracing to see if everyone was accounted for. So I found that interesting that it's now not only DOH, but even Joint Commission that's taking an interest in this. So while there was no particular penalty and it seemed just a general, just check and make sure that you're doing due diligence, clearly there was some effort towards it. Renee has a new guest.
Oh.
Who's licking her face.
It's Chewy's reminding me that it's afternoon. It's time to go outside. I'm sorry about the conflict, Chewy, but I have a call.
All right. Any last minute questions? All right, all. We will see you back in 2 weeks. So have a lovely, certainly keep the questions coming, and hopefully things are even better the next time we talk.